Hey everybody, how you doing? It's me, your girl, Passion One, Passion for Life. Today is actually Monday, October the 19th. It is my baby boy's birthday. Happy birthday, Solo. Mama loves you. Smooches. Um, the reason why I'm on here today is because some of you might have followed me on my previous channel that I had, Passion One. This is actually a new channel, and I don't have that many uploads on this channel. If you want to put PASUN1 in the search bar, you'll see me in my videos from my previous channel. And that gives you some insight on my weight loss journey, my breast cancer journey, and some other things that I've been through. So since this is October, this is my first breast cancer post on this channel. And for the new people that are new subscribers, I just wanted to come on here and sort of kind of share my story with you. Not that it has anything to do with being related to breast cancer, but my biological mama died at age 43 from lung cancer, and my sister died at age 43 from a heart attack. She wasn't sick or anything like that. It was a freak accident. That's a whole nother story. So at age 43, when I turned 43, in the whole year of my age of being 43, I just felt like I was doomed, like something was going to happen to me. So let me see. So at age 43, something did happen. I had started seeing a new practitioner, and this new practitioner was like, okay, you're diabetic and this and that. So by the time you come back to me in 6 months, you have to have your diabetic foot exam done. You have to have your eyes done. You have to have your mammogram done, and all this stuff. She just gave me this list. I want you to have this stuff done by the time you come back, because you're not getting any younger. You're getting older, and we have to do these things. So, okay, month by month, I got what I was supposed to get done. So I scheduled my mammogram, and I went, had my mammogram done, and they called me back, and they said, we need you to repeat your mammogram, which I really wasn't too concerned, because I have had repeat mammograms in the past. Actually, the time before that, when I had my repeat mammogram, I did the mammogram, I had a repeat mammogram, and they said, come back in 6 months. That 6 months turned into 10 years, which brought us to the year of 2011, when this new doctor told me that I had to get a mammogram done. So I do my mammogram, I do my repeat mammogram, and after I do my repeat mammogram, they said, well, we keep seeing these what looks like calcifications, and so we want to do an ultrasound on you. Okay, still not thinking too much of nothing, because I'm a very positive person when it comes to life and everything, and I know the Lord, and I try to live right, and I try to do right by people, so I'm not thinking like anything bad is going to happen. So I do the ultrasound, and they said, well, we're not sure if they're calcifications or if they're tumors, but we want to do a needle biopsy to like aspirate some of the tissue. And if you have never had this done, or you have never been really close to somebody that has had breast cancer, you lay on a table, and this table literally has a hole in the middle of the table. So you lay face down, and whichever breast is affected, you put that breast through the hole of the table, and your breast is just hanging through the hole. And there's a machine that the doctor and the assistant could see like a image on, like not ultrasound, that's not the right word, but they could see an image of I guess like an x-ray of what's going on. And they go in with a needle and do some numbing with lidocaine on certain spots, and they go in, and whatever tissue they take out, they put markers inside your breast, so they'll know exactly where those samples came from in case it happens to be something later on. Okay, so I had that done, and I had that sent off to a pathologist. So the pathologist calls the findings into the surgeon that I had initially went to. So when I go see the surgeon, he says, well, I don't have the results back. And I was getting ready to go on vacation. This was the end of July, and I was going to Vegas the first week in August. So he said, go ahead to Vegas and have a good time. And when you come back, come to my office. Come straight to my office. And I'm like, well, do you want me to set up an appointment now? No. You don't have to set up an appointment. Come straight to my office. Now, come on now. I'm not crazy. I thought something was up, because when I went in the office and I initially said, what my name was, everybody was like, oh, they're so nice and everything. And I know people in the medical field, because I'm a nurse myself, are really nice and have an excellent bedside manner. But these girls was just like laying it on too thick. So, and I'm like, well, who tells me that I can come straight in the office and don't make an appointment? Who does that? So I go to Vegas. I have a wonderful time. I come back that Monday. I go to the office. I have my mom with me. I go in the back, and he tells me that, out of the, I think it was 3 or 4 tissue samples that they took, that it was 4. 3 of them were just calcifications, and so that was fine. However, this 4th one showed cancer, and it was malignant. So, not knowing, I asked, what stage is it? Breast cancer is staged by the size of the tumor. Fortunately for me, mine was very small, so I was stage 1. Now, had I had listened to this surgeon from the beginning, I probably would have panicked myself thinking I was stage 4, because he later sent me for a MRI. And when I went and had the MRI done, he gave me a measurement that was just like 7 point something centimeters by 2 point something centimeters. And I'm like, that's my whole damn breast. But it was an MRI, and that's magnified. So he was seeing the magnification of the tumor, not the actual size of the tumor. So God is good. Just so happened that the doctor that had done my previous lap band surgery, they were oncology doctors. So I decided to call them to get a second opinion and see what they said, because I really felt like I was not getting my questions answered from the first doctor about what my options were and where do I go from here, and it was just like really confusing to me. So I went to my second set of doctor, and I told him exactly what was said. He had all my previous MRI, my ultrasound, all my previous lab work and everything. And then he told me exactly the type and how it's staged and what my options were. Now, the first surgeon said that he would suggest that I have a lumpectomy because, now remember, he just told me it was 7 point something by 2 point something. So he don't want the whole breast to come off. He just want me to have a lumpectomy. But in my mind of mine, some things as a woman you come to terms with. And I had always told myself if I ever had breast cancer, I would have the affected breasts and the unaffected breasts removed, because I didn't want to have to go through a battle and be healed and then have to go through the same battle in another breast. So I did not have both breasts done. I had only my right breast done because my adoptive mom, so when you hear me say mom now, that's my adoptive mom, because my biological mom, like I said, is deceased. My stepmom, Frances, she begged me not to have both of my breasts removed. She said it was too much, so I didn't. So I was like, okay, I have breast cancer. I have to have, or I want to have my breast removed. But what do I do? How do I do it? What do I do? Several years before this diagnosis, I had been thinking about having a tummy tuck because I have had a large stomach for a large portion of my life, to the point that people have came up to me thinking I was pregnant and I wasn't. So I got on YouTube and I got on Google and I tried to look up every form of breast reconstruction that was available to me. I wanted to look up how your insurance pays, the different types of implants, the different options, the recovery time, all of that. So I stumbled across a couple of videos of one called a deep flap and one called a tram flap. I opted to have the tram flap. Now, a tram flap is when they basically do a tummy tuck. They take the skin and the fat from your abdomen and they reconstruct you a new breast. They take the muscle they took the muscle from the left side of my abdomen. You know how you have those two muscles that go down? They took the muscle from the left side of my abdomen and attached it to it's hard to explain it. It's like if you see two muscles and you have fat and you still have the muscle attached to that flap, it's a way you flip it and bring it up to put it inside of that breast, because the breast still has to have a blood supply. So until your breast that abdominal tissue until that abdominal tissue and the vessels can attach to the vessels in your breast, you have to have something to feed the blood supply. So that's why the muscle was used. So my abdominal core is very weak because I only have that one abdominal muscle right there. So I was like, well, this is the best of both worlds, because I'm getting a tummy tuck and a breast at the same time. I always say if I go to sleep with two breasts, I want to wake up with two breasts. So I had my surgery on October 25th, 2011. So this Sunday, I will be 4 years post-op. I went into surgery about 1 o'clock during the day. Before I went into surgery, I had to go to like nuclear medicine, and they take a needle and they inject a dye into my breast, and the dye goes in the breast and to the lymph nodes of that arm, and they go in and they dissect some lymph nodes, and they want to see if those lymph nodes have been affected by the cancer or not. I think they took 4 lymph nodes out of my right armpit, and they were not affected by any cancer, no cancer cells in them. The general surgeon started on me at 1 o'clock, and the plan was he was going to start to remove all of my breast tissue, and when he was maybe about 85% done, the plastic surgeon would come in and start to harvest the fat from my abdomen to make me a new breast. So I was in surgery for about 9 to 10 hours straight. When I got back to my room, my mom and the guy I was dating at the time was in the room. And I mean, I was awake enough to know that they were in the room, and I saw them, and I know it had been a long day for them and a long day for me. So I told them that they could, you can just go ahead and go home. But while they were in there, the nurse was, I had a drain in my right breast, and I had a drain in my lower abdomen. And when the nurse came in to empty my drain, she emptied the drain. It's a JP drain, Jackson Pratt drain. She emptied the drain, poured the solution into a cup, and flushed it down the toilet. By the time she came back to me, the drain was already almost halfway full. And I mean that in a matter of seconds. So, being the good nurse that she wasn't satisfied with that, and she went and made a phone call to the doctor. So in the meantime, I told my mom and my boyfriend to go head home, and if anything comes up, we'll call them. So after maybe an hour or so, my surgeon told her to prep me and have me sent back down for surgery. So they called my mom, and they said that she's going back into surgery, but don't worry, everything's going to be okay. I had developed what they call a hematoma, and the blood was like pooling up under my skin, and it wasn't coming out or draining like they wanted it to. So I went back into surgery, I guess close to like 1 o'clock in the morning, and got back in my room like 3, and I think I slept so long the next day. I actually have a video on that other page, Passion 1, of me waking up and posting a video, because all I could think of is that I wanted my YouTube community to know how well I was doing. I was in surgery for so long, I had got a pressure ulcer on my tongue. You know how you have the little white taste buds on your tongue? My tongue was pink, where the tube that was down my throat had so much pressure on my tongue for so long that, and it took over a week for my tongue to get back straight. I laid on the table for so long with my arms stretched up behind me. I had my muscle where my back shoulder blade was sitting out like the Hunchback of Notre Dame. I could not raise my hand above my head. I started taking physical therapy because my arm, I had so limited movement with that arm. I had to take physical therapy. Okay, so in the process of taking physical therapy, I go in and have a portacaf inserted under my left upper chest. And this is the port that I am going to have my chemo in. The day that I go for my first chemo treatment, my port was not cooperating. It was unable to access. They stuck me, they stuck me, they stuck me, they stuck me, they stuck me. I mean, it got so bad to the point that I just started crying. And my mom was like, what's wrong? And I'm like, I'm just, they just keep sticking me, and it hurts. And why they keep sticking me? So they took me over to radiology, and they did like an x-ray, and they found out that the line was kinked. It actually looked like a cursive M in going from my chest in my neck. It looked like a cursive M. So no chemo that day. Had another surgery to take that one out and have the other one put in. I think I had the surgery on a Monday. It was an outpatient surgery. And I think that Wednesday I had my first chemo session. It was very tender and very sore to touch. So, when they went to stick the needles in the port, it was pain there. I mean, it was tolerable, but it was pain there. Chemo did okay. I had 4 rounds of chemo, and it's a very complex puzzle when you talk about your cell count. I have chemo, my cell count goes down, then it starts to build up, and when it starts to build up, I think it was a 21-day cycle or a 14-day cycle. Every 21 days or every 14 days, something like that, I would have it done. And I lost all my hair on my head, my legs, my eyebrows, my private part. Everywhere hair grows, I lost it. My fingernails turned black, so I would always paint my fingernails black. To me, that was easier than having to explain to people why my fingernails look so dark. I had sores in my mouth that didn't want to heal, and they make you this special like chlorhexidine mouth rinse that is horrible. I slept for 3 and 4 days at a time with no appetite. I really didn't have that much problem with nausea and vomiting, but I stayed tired a whole lot. And being that I do work at a nursing home, and it was in the dead of winter, and everybody was getting the flu and all that, I did not work. I stayed out of work for when I had my surgery in October, I didn't go back to work till the middle of February. So I went through chemo, and that was fine. When I went back to work, I felt okay, and it was just hard getting back into the routine of doing work, for 8 hours after being out of work for so long and my body going through so much. So that is the short version. If there's something more specific that you want to ask me, like the specific type of cancer that I had, or the specific type of chemo that I got, or anything that, if you're going through this, if you have a friend going through this, if you have a similar story, please post a video sharing your information with me. I would love to be your YouTube friend, so please subscribe to me. Please like me. This is just one of many videos that I'll be sharing with you about my journey as a breast cancer survivor. I have really, truly been blessed. God has really been good to me, and I never questioned why me. Since I've had this breast cancer, I have seen life in a whole new light. I love deeper. I cherish relationships more than I ever have. I have zero tolerance for foolishness. None in my life. None whatsoever. So, like I said, if you know anybody that went through this story or going through this story or newly diagnosed, we got to stick through this thing together. So, hit like and hit subscribe, and thank you for taking time to listen to me. Smooches.